Coming of Age is coming up next. I'm your host, Emily Echeverria. First today, we're talking with Toinetta Coolie of the Baptist Heart Vascular Institute about the symptoms, signs, and treatment of heart failure and the vital work of Baptist's Heart Optimization Clinic. Next, we'll talk life-limiting condition care and demystify palliative and hospice offerings with Emerald Coast Hospice. Finally, we're celebrating a belated birthday for the 100-year-old Grand Dame of Palafox, the Saenger Theater. Stay with us. Coming of Age starts right now. As we age, staying active and connected to community can sometimes become more challenging. But with Council on Aging of West Florida's broad range of home and community-based services, you can stay healthy, independent, and engaged in life. From Meals on Wheels and respite care to senior dining sites and the retreat, we provide the support and connection you need to age your way. Aging is a unique journey for everyone, and we're here to help you meet your needs and thrive while preserving what makes you, you. Since 1972, we've been a trusted advocate for elders and a support system for those who care for them. Now, let's dive into the age-related issues that matter most to you. Approximately 6.7 million American adults currently live with heart failure, and that number is expected to rise with an aging population. Here today to discuss the signs, symptoms, and treatment of heart failure is Toinetta Coolie with the Baptist Heart Vascular Institute. Thank you, Toinetta, for joining us today.
Thank you for having me.
So first of all, what is heart failure?
So heart failure, Emily, is a chronic condition when the heart fails to pump the adequate amount of blood to the body, causing symptoms such as swelling, shortness of breath, and worsening fatigue.
And can someone live with heart failure?
Oh yes, patients can live productive lives with heart failure with the right medications, eliminating risk factors, and diet, and that could include diet and exercise as well.
Gotcha. So what are the risk factors which can lead to heart failure?
There are a number of risk factors that can lead to heart failure, such as uncontrolled hypertension, uncontrolled diabetes, some cancer treatments, arrhythmias of the heart, excuse me, and obesity. Those things can lead to heart failure. Sometimes it's genetic, and it may just be a family affair.
So who does the patient see to treat heart failure?
So we have cardiologists, and in the heart failure clinic or the heart optimization clinic, which we're trying to transition our name, patients see a nurse practitioner in our clinic, and then the patients are typically seen initially by the cardiologist in the heart failure in the hospital when they're diagnosed with heart failure, and then we have patients that are referred from their primary care provider as well.
Gotcha. And what can a patient expect from the heart failure or heart optimization clinic?
So in our clinic, patients, we try to take away the misconception that patients are going to some type of group meeting. And patients can expect to be seen by a provider, a nurse practitioner, and during that time we go over their medications, we talk about any symptoms they may be having, we do diagnostic treatments, we're equipped now to do our own labs in the clinic. And so we work with patients as far as obtaining their medications. So those visits, even if it includes education, we do have a part-time dietitian as well as a heart failure registered nurse who educates our patients as well.
So tell me, what else does the clinic do?
Oh gosh, we have so many things available for our patients. Our main concern is making sure that patients are able to get their medications. We also refer patients out to if they need pulmonary, if they need nephrology, sleep studies, any type of testing. Like I said, we do our own labs in the clinic. We provide lift rides for our patients in the surrounding Pensacola area with the help of the Baptist Faith Health Network as well as the foundation. We've been able to supply our patients with blood pressure monitors and weight scales. We do a lot of community activities. We have hosted and participated in several community health fairs as well as educational events. We try to educate the community and our patients. That's really huge is educating our patients.
Okay. And how can people find out about events and things that are coming up, like those outreach events you mentioned?
So a lot of these events are on our Baptist website, as well as word of mouth through the Faith Health Network. A lot of outreach programs are done that way, and then they get them through the clinic as well. And I forgot to mention that we also have direct access to our patients have direct access to us, so they have a personal cell phone that they can call in order to contact us.
Oh, excellent. So you work with a lot of different other groups and organizations within Baptist to really get the word out and get what your patients need.
Yes.
You mentioned that some of the patients come from the hospital when they're diagnosed. What does that diagnosis look like?
So patients are diagnosed with congestive heart failure, and I know it sounds bad. It sounds bad to the patients. They think that their heart is going to stop at any moment. And that's why we're working to change our name to the Heart Optimization Clinic, because our goal is to optimize patients with medications, optimize their health, so that they can live those productive lives. So that's the overall goal for our patients.
Gotcha. So the name of the disease itself is heart failure, which sounds like the heart has just stopped.
Correct.
So you're talking about helping it work to the best of its ability.
Right, and finding out heart failure is, you have to find the cause. Typically it's caused by something. Once we find the cause, we can treat the cause and treat the problem. And it takes about 3 to 6 months, sometimes a year, for some patients to see a difference. But it is possible with cardiac rehab. We send patients to cardiac rehab if they're, if they need it. Some patients have physical therapy separately, or cardiopulmonary rehab. We don't offer cardiopulmonary rehab, but we have referred patients to Sacred Heart for cardiopulmonary rehab.
Gotcha. And you support patients in having those lifestyle changes that they might need for better cardiovascular health, right? So what does that support look like?
If some patients may need to be referred to our weight loss clinic, so for weight loss management, if it is referring patients out to home health or palliative care or hospice, a different type of specialty. Some patients need pulmonary, some patients need nephrology. And so working closely with these different specialties helps the patients. And that's basically our Baptist mission, is to help patients throughout life's journey. And so in order to do that, we have to make sure that they have everything that they need. We can't just focus on one entity, and because we work together to make sure that the patients have what they need.
So more holistic look at
yes, exactly, holistic approach to care.
Gotcha. Excellent. Anything else you want to add about the Heart Optimization / Heart Failure Clinic? We
work as well. We're trying to work right now with eliminating some of the emergency room and hospital readmissions. So we work really closely with our infusion clinic, and we have an upcoming project that's coming soon to help our patients as well, so that we can eliminate some of those unnecessary or needed visits, but just more education for our patients, as well as IV therapy.
Awesome. Well, thank you for joining us.
Thank you for having me.
Stay with us. We're discussing the important care decisions of end of life with Emerald Coast Hospice. Up next.
Navigating healthcare is hard. Baptist makes it better. With convenient locations, easy scheduling, and skilled, compassionate doctors, all when you need us most. The next time you need care, let Baptist make it better. Baptist Healthcare.
By the time you see the symptoms of lung cancer, it could be too late. Now there's a new scan that can detect lung cancer early. If you smoked, get scanned.
Have you recently been involved in a car wreck?
Well, if so, we can help.
That's right. We can help you get the cash you deserve for that junk car in your yard. At Frank buys junk cars, we buy junk cars in any condition. Call today, get paid today.
Frank bought my junk car for $400 and I spun the King's prize wheel and got an extra 20.
I'm Frank, Pensacola's Junk Car King, and I approve this message.
When a loved one has a life-limiting illness or is in need of hospice services, caregivers face a daunting road ahead. It's essential to get informed of your options to ensure you and your loved ones are fully prepared. Whether hospice or palliative care, these services can take some strain off patients and their family during this challenging time. Here to tell us more about these issues are Amie, Harvey, and Dyan, Wofford with Emerald Coast Hospice. Thank you both for joining me today.
Thank you for having us.
So first of all, tell us a bit about Emerald Coast Hospice and your roles there.
Sure. So I am the Area Vice President of Business Development. I've been with the company since approximately 2016, so I've been with them for quite some time. Emerald Coast Hospice has been in the Emerald Coast community for well over 20 years. We have 8 branches across from Pensacola to Panama City. We are a nonprofit, which means that we have a foundation which gives back to the other nonprofits in the community. Mm-hmm. We serve over 1,000 patients currently with compassionate care, patients and their families.
My name is Amie. My main role is a hospice care consultant. I meet with the families to give them information about hospice and palliative services.
Gotcha. And what is the difference between hospice and palliative services?
Hospice services would be for any patient that decides that they want to end any aggressive treatment, that they would like to get care at home. The main goal of hospice is to keep any patients comfortable at home, to stop any ER visits, any hospital visits. They would have a nurse that would come out 2 to 3 times a week depending on their care. They have an aide that would come out to see them 2 to 3 times a week as well. They are offered a social worker and a chaplain for any other services needed. Palliative care is for any patients that are looking to still seek aggressive treatment. That is a nurse practitioner that would go to the home once every 3 to 4 weeks, depending on the level of care. If a patient has higher needs, those visits can be bumped up, but they can order x-ray, labs, things like that at the house.
Gotcha. So what qualifications must a person meet for hospice care?
So Medicare sets certain guidelines depending on the specific disease. However, there are some general guidelines that you can look for when determining whether someone needs hospice care. That would be unexplained weight loss, or in the case of congestive heart failure, weight gain because of fluid retention. If they've had multiple hospitalizations over the past 6 months or year, they're sleeping more, if they have decreased appetite, those are the types of general things that you would look for a patient with a terminal illness that would indicate that they would need hospice.
Gotcha. So what is the end-of-life care experience like for the patient and the family?
So we value quality over quantity of life. So we try and help that patient and family find as much joy as they can in the time that they have left. Mm-hmm. There's a lot of misconceptions about hospice, that we come in, hook somebody up to morphine, and they can't talk, they're bedbound. However, we have plenty of patients that still enjoy life, some even travel. So our goal is to increase their quality and let them enjoy the time that they have left with their family, as opposed to being in the hospital and everybody being worn out from running back and forth, and they're all at home together and can have a good experience as that patient approaches end of life.
Yeah, I think there's definitely those misconceptions out there about what hospice is, and maybe it's used interchangeably with palliative a lot of times as well. So does insurance cover these services?
Yes, it does. So for hospice, we can pretty much help anyone. Any insurance we're able to take. If there is a patient that is unfunded, we're able to take them. So if they don't have insurance, that's not a problem. Palliative care, we can take anything. We don't have a contract with Medicaid and Blue Cross Blue Shield. So those are the only 2 that we are not able to take with palliative care.
Gotcha.
And Medicare does, if a patient's on Medicare, which most of our patients are, no matter if you're on an Advantage plan or straight Medicare covers the hospice services at 100%. So that means all the visits, any durable medical equipment, their medications, incontinence supplies, it's all covered at 100%.
Excellent. So where does hospice care occur?
Hospice can take place wherever the patient calls home. So we have most of our patients are at their home. We do have patients that are in assisted living facilities, skilled nursing facilities. So it's really just wherever that patient calls home.
Gotcha. And what do these services look like for a patient that has dementia?
So with dementia, there's a lot of education because most people don't understand how to deal with behaviors that occur with dementia. There's no real medication that helps that person. If they have some pain, of course, we will treat that. It's typically caused by some other comorbidity. So with dementia, whoever the caregiver is, whether they're in a home, in an ALF, skilled nursing facility, whoever's caring for that patient, we do a lot of education with them on how we can react so that we don't cause them to have those behaviors. Most of the dementia behaviors are caused by us and how we approach that patient. So that is a big piece of caring for dementia patients is the education and support that we give the caregivers.
And tell me more about that kind of caregiver support that you offer for any of the services.
Sure. So there are times when the caregivers or family need more support than the patient. The patient's fine, they've lived a long life, they're ready to go, but the family's not ready to let them go. We have our nurses, our social workers, our chaplains are all well trained in providing that support and helping the family get prepared for the end of life. I always tell people that we do a lot of preparation for the birth of a child, and death is just as inevitable as birth. We tend to ignore end of life, and we don't prepare well for it. And our role is to help the patient and the family prepare for when that end of lifetime approaches.
And what would be one thing you would say to families to be better prepared?
To not be afraid of the word hospice. We aren't there to speed up death. We're there to provide support. And studies have shown that patients actually live about 3 months longer on hospice care than they do when they do not have hospice care. So if the end of life is coming, it's going to come with or without hospice. And I would like people to understand that it is much easier when they have support than it is when they're trying to do it alone. And we're there to support them and the patient and the family.
Excellent, and it's much needed support. Thank you both for joining me.
Thank you.
Absolutely. Thank you, Emily.
Up next, there's no business like show business at Pensacola's own historic Saenger Theater. Stay tuned.
Trusted specialists at convenient locations throughout the region ready to care for you. All when you need us most. Let Baptist make it better. Baptist Healthcare.
The Reesburg Institute, Pensacola's ear, nose, throat, and voice center. We welcome you to visit us at our convenient Davis Highway location in Pensacola. At the Reesburg Institute, we offer the most advanced treatment available in a calm, stress-free environment. Since 2014, we've performed over 1,000 cases in office of balloon sinus surgery, as well as septoplasty and nasal procedures using oral sedation. The in-office procedures result in a faster healing time. Visit us and feel the difference.
Pensacola's Saenger Theater has been a mainstay of Palafox and an iconic entertainment venue for the last century. She has hosted a huge variety of shows and performers on the stage through 100 years of storied history, and there's plenty to look forward to both in the near and longer term future for the theater. Here to tell us more about what we can look forward to on the stage and behind the scenes is Marketing and Event Services Manager Kristen Carter. Thanks for joining me.
Actually, I have to stop you there. I am technically now considered the Senior Marketing and Sales Manager. My email signature hasn't been updated yet.
Congratulations.
Thank you.
Promotion. So yeah, tell us about your role with the Saenger, as you were just saying.
So I've been with the theater for about 8 years or so, on and off throughout the time that I've been there. I started as just a little event ticket seller in the evenings. Eventually I moved into the box office in a more like part-time management role. And then I came back on after COVID, everything kind of, the world went away for a little while. And when we returned, I was able to go back in a management position full-time. So now I do the marketing and I do sales for advertising in the building to improve on everything that we have to offer and to possibly bring in newer and bigger shows that Pensacola hasn't seen before.
Excellent. So 100 years of history in this theater. Can you tell us just a few of the high points on the kind of timeline of the history of the Saenger?
So the Saenger brothers started all of this chain of theaters along a specific path. It was originally meant to be like a series of vaudeville theaters in the 20s, so they could basically set up a tour and route everybody through their theaters and do very well with all of the different shows, and they kind of had control of all of it. And the Pensacola Saenger was actually the very first one that was constructed in 1925, and there were at one time almost 100 of them or so.
Yeah.
And it's now just down to a small handful, so New Orleans and Mobile, there's one in Hattiesburg, but at this point none of those we're not related to those anymore, but we've kept the Saenger name because it was, the namesake. But it's been part of Pensacola since 1925, and it's been through a lot of different changes. It was, the vaudeville theater, became a movie theater, and then it kind of fell into a state of disrepair and then became revived when the city of Pensacola purchased it in the late 70s, early 80s. And it was actually the Friends of the Saenger, which I'm sure we'll talk about a little further here. They were very instrumental in making the Saenger what it is today.
So tell me about the 100-year celebration of the Saenger. I know it has happened already, but how did you mark that?
So it was definitely a very big event, and I have never really undertaken anything quite like that before, and it was really fun to do, though. We did a big street party, and we also showed a screening of the Phantom of the Opera, the 1925 Lon Chaney silent film. And we did another day, that was on, originally it was supposed to be April 6th. We did end up having to reschedule for weather. And the original opening day, well, the first public open day was April 2nd, 1925. So we did some tours and open houses and everything like that. We did the big birthday cake that day. So that was, and we showed the 10 Commandments, the Cecil B. DeMille original silent film. And so we did all of these different things, and putting it together, it was just a lot of different people coming together in the building. We scheduled 100 events over 100 days that were in the middle of that time frame. So it was a very big project, and we actually partnered with Appleyard Agency and Duncan McCall because some of their employees are our board members. So we have for the Friends of the Saenger. So we have a good relationship with them, and they helped us a lot with getting out in the community in larger ways than we could on our own.
Excellent. So speaking of the Friends of the Saenger, I know they've had a huge impact on the renovation projects over the years. So what projects have they contributed to, and what are they working on now?
So the main thing that came about was to save the building. It was because there is the Morton organ, her name is Lola, that lives in the building. Lola actually saved the building because it made the building a historic location, and they were able to fight to have it not torn down because of that connection. So the Friends of the Saenger kind of came about in the 80s, early 80s. I think the initiation day was like St. Patrick's Day, 1980. They came together to save the organ in the building, and their first big project was turning it around into that. And for a while, they actually were the management company behind the building and ran the whole thing. It grew a lot more than I think they thought it would, so we had some other people come in to help us out. And they also, in 2007, the building shut down, and the Friends of the Saenger were absolutely key in that renovation that added the addition on Intendencia Street with the conference room upstairs, redid the whole backstage, added a same level dressing room, and they had sponsors, and they collected donations, like out on the street fighting for donations. And it took them 2 years to do it, but it was all the Friends of the Saenger that made that even possible for the way that the building is as it is today.
Yeah, and it's so gorgeous in there now.
Right.
I love going to performances there. Well, tell me a little more about the organ. What are they working on with that?
So the organ is definitely a project that they've been committed to for a long time. And the next thing that we're really looking to do with them is to rehabilitate the organ to its entirety. At this point, it's about halfway completed, and it's about, let's say, at least $3 million to restore it. It's very, it's very in depth. You know, it's not a small project, and there's not a lot of people who have the skills to work on it.
Yeah.
So the Friends of the Saenger are starting a campaign to see if we can restore it to its full glory.
Yes, and I did see a little bit of it getting played during that Phantom of the Opera showing, and it rose up out of the stage. It was very awe-inspiring. It was melodramatic. It was awesome.
Right. We like to use it in those events where we can, just to feature and let her come out.
Yeah.
To play.
It's good to see Miss Lola.
Right.
So how can people get involved and support the Saenger or these projects?
The best way to do that is really to get involved with the Friends of the Saenger. They have a different membership tier levels that you can join. You can make donations to that organization. They are a nonprofit, so everything that they do goes into the theater just for that purpose. And we do have some volunteers. We are not really in a volunteer program at this point. It is maybe something that we'll be opening up again to have people come in and participate in the community. But the Friends of the Saenger, you can join, you can donate, you can participate in different events that they host, and even get some tickets for the reception that they hold at the Broadway shows. And it's kind of a little perk if you get to do that.
Oh yeah, excellent. So just quickly, are there any upcoming events that you want to plug before we go?
So we are really expanding our programming, and we're showing a lot of different things that we haven't really done before, and it's to include everyone in the community, and that way everybody gets to participate in something that is in the theater, and it's not just regimented cultural art. So we have a lot of different comedy shows coming up, a lot of different rock bands, and we're hosting some of our own small events that are more like private events, and we have one coming up that is a murder mystery dinner theater that we're partnering with Going Noir Mysteries, and that is on July 12th, and it will be on the stage. So you'll get to sit on the stage and have dinner while participating in the murder mystery show.
Interesting. I was wondering how that would go. All right. Excellent. Sounds like there's a lot going on, and thank you for sharing this with us.
Oh, yes. Thank you. Thanks for having me. Thank you.
And thank you for watching. Until next time, enjoy life. You've earned it.